Good morning, everyone. My name is Elizabeth Medina Kramer. I'm the Director of Operations. I will be hosting today's meeting and the rest of the meetings that we have coming up the rest of the year. Our colleague Natalia Figueroa has gone on to her future endeavors. We wish her the best. So please be patient with me as I'm taking on this new role and still learning how she would run her meetings. We will start with our presenters who will give the presentation. Afterwards, we will start with the Q&A, and then at the end, we will give any updates that our partners have. With that being said, if Juvencio has any words.
Good morning, everybody, and happy Monday, everybody here. Welcome to the NC Latino Health Alliance, and we look forward for our speaker today. And thank you, Francisco, for agreeing to be with us this morning. And pass it back to you, Maria Elizabeth.
Thank you. So now I'll pass it on to Francisco, Sarah, and Kayla for the presentation.
Muchas gracias, Elizabeth. Thank you very much. Thank you, Juvencio, and all your team for this space. It's very important for us present what the Division of Child and Family Wellbeing is doing at the Department of Health and Human Services of North Carolina. I have another colleague from another sections of the North Carolina Department. And please, Elizabeth and I were talking, if you have any question, the questions will be at the end. Take your notes. And when Natalia and Juvencio and the Amascan team invite me, I was trying to figure out, because the division is kind of big and is one of the priorities that the secretary has. And I was trying to figure out if I come by myself or with another colleagues. Today, I have the fortune to have two more colleagues that are going to be talking of specific sections that we have, specific programs that we have, that for me are a cue for our communities. I'm going to share the presentation. Just give me 1 sec. And yes, if you don't mind, put your information in the chat. We will appreciate it. And here we go. Just Elizabeth, let me know if you guys can see the screen.
We can see it.
Thank you so much. Now, the Division of Child and Family Wellbeing, it's been for years, the department. In 2022, officially, they changed the name to this division. And of course, the division focus in a lot of things. But before starting, because I believe all of you are involved in health, and all of you know very deeply the North Carolina Department of Health and Human Services, we have a question for all the audience here. And drop me a couple of numbers in the chat. Maybe you can help me a little bit about this question. All of you know how many divisions and programmatic offices the North Carolina Department of Health and Human Services has. Give me numbers. If you're still drinking coffee, that is fine. Just give me some numbers in the chat. Okay, well, we have 10, 12, 5. Okay. 15, 8, 30. Good try, Marlene. Good try. Okay, at the department, officially, we have these divisions and programmatic offices. And I put in yellow 3 of them because sometimes people get confused in the community. And I'm telling you this because every single time that we go to different groups, they get confused. We are the Division of Child and Family Wellbeing, but as well, we have the Division of Child and Development and Early Education. That one is regarding all of the information with daycares. And we have social services. As the Child and Family Wellbeing promote programs for children and youth, social services does a lot of things regarding children and youth as well. But at the division, we don't do any type of application because sometimes it could be confused. All the applications regarding Medicaid or FNS. They do the applications with social services. Now you have a real number. At this 2023, 16 are the official ones. This is a list. This is totally public information. You can find it on the department website. Okay, now let's see. The division, okay. This division has a goal: promote very healthy spaces, families, schools, communities, and programs that serve children and youth to improve the health and the well-being. And the division is divided in four in four sections, sorry. We have the food and nutrition service, the community nutrition services, the whole child health section, and the early intervention section. At this time, some of my colleagues that are going to be presenting with me, we are going to talk of a specific programs to some of the sections. But I want to tell you something of both sections, and maybe you may know, maybe not. The early intervention section provides the support for families and children from 0 through 3 years old with special needs. That means, like, if you guys have a baby with any special medical need, you may knock the door to the early intervention section. Through the presentation, I'm going to be putting in the website some links that you can figure out. And the links, of course, are in English and Spanish and other languages as well. And the food and nutrition services, as you can imagine, still a lot of communities, if they are allowed to apply, they don't want to apply to the food and nutrition services because they are afraid, because they think like applying for FNS, they will have a public charge in the future. But helps eligible people with limited incomes supplement their budgets, so they can purchase food. They receive a car and they go in the entire North Carolina to buy food. But now I want to introduce the community nutrition services section. And for that, I have my colleague, Sarah Moss. Sarah, thank you very much for being here. And the floor is yours, Sarah. Go ahead. You just tell me next.
Okay, great. Thank you, Francisco. Hi, everybody. My name is Sarah Moss, and I am the Nutrition Education Training and Outreach Team Lead for the WIC program within the Community Nutrition Services section. And we have one other program in our section, the Child and Adult Care Food Program. So we have two big programs within our section, but I'm just going to talk about WIC today. So, okay, go ahead, next slide. So what is WIC? So WIC is the short name for the Special Supplemental Nutrition Program for Women, Infants, and Children. It is a public health nutrition program that's been around for almost 50 years. Next year is our 50th anniversary. And we are within the Community Nutrition Services section within the Division of Child and Family Wellbeing, the new division that Francisco was just talking about, and underneath the Department of Health and Human Services, or NCDHHS. We are a federally funded program funded by the United States Department of Agriculture, or USDA, and then FNS, Food and Nutrition Services, at the federal level. FNS, or food stamps, some people call that SNAP, is one of our partner programs within the division as well, but it's not the same program. So sometimes people can confuse those two programs, but we are separate from that program, but both federally funded. Similar population though. Okay, so and as the WIC program, we work to assure healthy pregnancies, healthy birth outcomes, and healthy growth and development for women, infants, and children up to age 5 who are at nutritional risk by providing nutritious supplemental foods, breastfeeding promotion, support, and education, and then education on healthy eating, and then also referrals to healthcare and critical social services. And that mission statement you see there is part of our National WIC Association, which is a advocacy group for the program nationwide. Okay, go ahead, next slide. And here are just a few facts. In North Carolina, we have 85 WIC agencies across the state, and we serve all 100 counties. We have over 245,000 participants each year in the program. That number fluctuates on a monthly basis, but right now we're holding steady between 245, 255,000 as far as our caseload. Across the United States, there are over 90, or there are about 90 state WIC agencies. So that includes states, territories, and ITOs, and over 1,900 local WIC agencies and up to 10,000 clinics. So lots of individual clinics. And over half of all the infants born in the United States are supported by the WIC program. Okay, next slide. So what does WIC provide? We provide, again, healthy food. We have 4 pillars that we have as part of the program. We provide healthy food, breastfeeding support and education, nutrition education, and then also community referrals. Okay, next slide. Thank you. And to be eligible for WIC, we have 4 eligibility criteria, and these are, we call them categorical eligibility. So folks need to have residential eligibility, live in North Carolina, qualify either by income or by adjunctively with another healthcare program or another program. And then they also need to be one of the categories I mentioned: a woman, pregnant, breastfeeding, postpartum, an infant or a child up to age 5. So that we call categorical eligibility. And then
Sarah? Sarah, can you hear us well? Elizabeth, can you hear me?
Yes, I think her internet might be a little bit behind.
Okay. Okay, let's do something. If you don't mind, we can wait that Sarah come back and we can follow the other part of the presentation. Sarah, can you hear us well? Okay, yeah, maybe she had some internet complications. Let's move on to the other part of the presentation, and then we can come back later with Sarah, okay? Kayla, if you don't mind to send a message to Sarah, then we will come back with her. I will appreciate that. Now we are gonna talk about the whole child health section. Elizabeth, can you hear me well?
Yes.
Okay, let's see. Perfect. Now, the whole child health section, I've been doing a lot of things regarding an outreach team that we have over there. And basically, we focus specifically in some activities with the communities. Enrollment to the Medicaid program, to visualize the needs of the children and youth with special healthcare needs helpline, and other resources for families. Now, we of course take care for those who doesn't have insurance, children and youth, family members who talk to us to try to figure out how they can deal with every specific situations in the community. We can refer and we can help them. As you can imagine, at the division, we do not have any clinic outside our building. We are based in Raleigh, where our jurisdiction is the entire state, but we connect, we guide, and we try to visualize how other agencies can partner with us and try to help others. All of you know everything about NCDHHS. Are you sure? All of you know everything about NCDHHS? I want to tell you, the NCDHHS, in April the 1st, finished something that was called CHIP. The CHIP was a program that helps families to have like cheap copayments, very small amount of copayments. But since April 1st, 2023, the government decided just to leave NC Medicaid. That is, of course, a funded health insurance program. And of course, it's open in North Carolina for people to try to get a better services of health. Who qualify to Medicaid? The child must live in North Carolina and of course has to have a proof of residency. Remember, if you are a refugee in the state or an asylum, depends the process that you are. It depends if you can be able to get a Medicaid. Of course, Medicaid works with a social security number. BH 0 to 20, focus with this. When you have a kid in a foster care, the Medicaid works until 26 years old. And there are specific situations when you are above 20, depends where you are studying. And as well, after 20 years old, we encourage you that if you don't have Medicaid, you can see like the Obamacare, the health insurance, for try to get another type of insurance. And the household must meet and have the income guidelines for this 2023. This is a real chart that we have and it's updated every year. And these are the maths that we have for this April 1st, 2023. I was wondering just if you can visualize numbers, but just as an example, because if you're a family of 4 and it is supposed that monthly you have to earn $5,275, just make sure that some of our families sometimes have different situations because maybe 2 months they were not working and now mom is earning less than last year. What we encourage the people is try to talk to the DSS, Department of Social Services, to try to figure out if they can allow. This is just a reference. Of course, if you are earning $25,000 a month, obviously is something that will not apply to you. But if you are in that range between the $5,275 and another couple of dollars, a little bit more, we still encourage you to apply because every single family has every single situation. Now, everybody here is aware that why we should have a health insurance for all of these. In my experience with families, getting dental care clinics for those who doesn't have insurance, it's been a nightmare. It's been extremely difficult. And of course, when we identify a family, when they are allowed to apply to Medicaid, we try to help them to try to connect with DSS office and to try to visualize what is important to apply for Medicaid. Now, to apply, recently it was a EPAS training. I don't know if some of you take this EPAS training. It was a hard training, I can say, because a lot of information, but this is an option. You can apply online through the EPAS. There are a lot of questions that they ask, but fortunately, if parents, they don't have a social security number, they don't have to worry about, but they must have an email address to do EPAS process. But if you are the kind of person that you don't like to deal with computers because maybe you are not that savvy, you are able to go to a DSS office. Remember that our families has to go to the Department of Social Services where they live specifically. And what happened for those who are arriving to the state? We recommend those families who contact us and they say, hey, we are here in New York and we are going to North Carolina for living. Before, I said to the families, before you pack in, talk to the DSS office where you're going to be living to try to see if you're going to apply. Because if you are in Florida, Georgia, whatever state, and you are receiving Medicaid or Medicare, depends the situation in your area, maybe the situation here in North Carolina is going to be totally different. Depends in the guidelines that you have. It's very easily do a pre-qualification at the DSS by phone. Obviously, after they apply, they will request a letter from the state that they were receiving services. But yeah, those families who are traveling to North Carolina for living, they can do a pre-qualification process. Now, you can tell me your experiences, and all of us know every single lack of information that we can have with our families. In our experience, all of these are through benefits of services. They don't know who is eligible. They don't know how to apply. but the immigration concerns will be the highest one that we've been receiving. Like, they are not happy to apply because they don't want to have their information in a computer. I mean, unfortunately, mom and dad, or maybe one of them, has to be related on a system. But yeah, we try to advocate for those families, saying that this Medicaid program is not a part of a public charge situation. Now, of course, we work with families without insurance, try to figure out with them how they can find a clinic. And we knock the doors to all of you. Thank you, Amescan, and all of those who are here in this virtual meeting, because we knock the doors every single day. If you are in a county, I believe you have all the hint of what's going on in your county. Even though we have found some people that they live across by a mobile clinic and they don't know that the clinic is there. Now, the division focus in the children and youth with special healthcare needs, and we have a helpline for that. What is a helpline? The helpline is line that has been there in the division for years. And in the beginning, the helpline was clear to help families with special medical needs, but now is more open. The helpline can do all of this for the families. We have a bilingual service on the helpline. If they call, they can ask for English or Spanish, and we have interpretation services as well. As I mentioned in the beginning, we connect, we refer with these experiences that they've been doing and having during the years. We know maybe exactly if your county doesn't have any program regarding IDD, maybe we know which agencies are going to help you around North Carolina. We help to find how to pay medications, equipments, utilities, food. That's why I said that the helpline is more than just a single line for special medical needs. It's very important that if you guys identify any person with a special medical need, I mean, you see the early intervention that I mentioned, 0 to 3, but we focus extremely deeply and we try to work with those who are advocating for families with special medical needs. It's a double challenge. You believe me this. If we have a family without special medical needs, it's a challenge. But if you have one with special medical needs, it's a double challenge. And more if mom and dad, one is agree about the special medical need and the other one is not agree, and we have to work from there, from the family need. How you can reach the helpline? There is a number. There is a totally free number, 1-800-737-3028, and this is the email that you have. I'm going to send Elizabeth some flyers that then, Elizabeth, if you don't mind, you can share with the community about all of these that we are saying here about the helpline and another program that is coming. As I mentioned, we try to do our best, and the health child section has another unit. It's called genetics and newborn. And for this genetics newborn, they have a really nice program that is helping families. And if you don't know this program, it's because maybe you haven't had any family with this situation. But I want to introduce my colleague, Kayla Armas. And Kayla is from Guatemala, has been here with us like more than 2 years. Kayla, thank you for joining us today. The floor is yours.
Thank you, Francisco. Do you want Sarah to finish her presentation and then I go? Or because she is back now?
Sarah, could you hear me well?
I can. I am so sorry, everybody.
No,
My
no.
internet cut out for a second. I was in the middle of my sentence and it just...
Please, no worries, no
Started-
worries. We are here for,
I apologize.
to help you and everybody understand these internet situations. Let me go back with Sarah, if you don't mind.
Thank you.
And then we go with Kayla. Thank you, Sarah, for coming back. Let me see. I believe I have this. Okay. And now I'm going to share. Sarah, let me know if it was that one or one before.
Yes, that's perfect. That's perfect. I
Great.
just finished the one before.
Thank you.
Okay. Again, I apologize, everyone. As I was saying, we have the categorical requirements for WIC. So who does WIC serve? So we serve pregnant and postpartum and breastfeeding women up to 6 months postpartum if they're breastfeeding, up to a year postpartum, and then infants and children under 5 years old. Again, participants must live in North Carolina. There are WIC programs in other states and they can transfer, but for North Carolina WIC, they obviously must live in North Carolina. We require income requirements. We have income as less than, it's a little bit more restrictive, I guess, than the Medicaid and FNS. It's 185% of the U.S. poverty income guidelines. So it's a little bit different as far as what they can make in a year based on their family size. But if they are eligible and participating in Medicaid, Work First for Families or TANF, or food stamps or FNS, then those programs automatically qualify many of our participants for the program without the need to look at income. So, and then again, that fourth requirement is looking at nutritional risk. And we have a nutritionist or a person that determines that risk of a participant when they come in for their appointment or their visit. And those kinds of things include things like anthropometrics, being overweight, maybe underweight, low hemoglobin, high lead, any medical conditions. There's lots of different things that would qualify participants, other medical diagnoses, things like that, food insecurity. There's a lot of things that would include or be part of that nutrition risk. Okay, next slide. And if a person does not participate in Medicaid or food stamps or any of the other programs that I mentioned, they may qualify just based on their income. And these are the income guidelines that we use for WIC. So again, they are a little bit different. They look a little bit different than Medicaid or TANF maybe. But the number of people in the household is listed there. And this is just a just short version of this, but you can see the overall gross household income there. And there's more information listed on our website as well, and on the federal Food and Nutrition Services page. Okay, go ahead and you can go to the next slide. And as far as citizenship status, citizenship is not required to receive WIC services. So this is a huge benefit for many of our folks across the state. WIC participation will not impact a participant's ability to receive other services or to attain citizenship. They don't need to show any proof of citizenship. We don't ask for anything at the WIC offices, and it's not required to participate. And I know during the last administration, it was difficult because of the public charge, but we were not included in that public charge. So please make sure folks know that. Okay, so go ahead and you go to the next slide. So what happens at a WIC appointment, if you're wondering, if you're not familiar with it? Several things happen. There's some verifications that happen with the identification, proof of residence, proof of income. And then a nutritionist there will do a height, weight, and a hemoglobin check, or that could come from a doctor as well. And then they would do a nutrition assessment or have a conversation and do a nutrition assessment and come up with a nutrition care plan for that participant or the participants in the family. And those include things like setting nutrition goals, providing centered nutrition education, looking at a tailored food package based on the WIC program's food package, the foods that we provide, and then referring clients to resources in the community or within the agency. Okay, next slide. And just a little bit about those healthy foods in the food prescription. So it is a supplemental food program, of course, and these are a few of the things that or the food benefits include foods that are high in fiber, low in fat and sugar. They're good sources of iron, vitamins A, C, D, folate, and calcium, and of course other key nutrients, but really important nutrients during pregnancy and during growth and development for infants and children. And monthly food benefits are issued through an electronic benefit account. And we have EWIC cards now that are like a debit card. It's a different card than the FNS or food stamps EBT cards. So if folks ask if they're the same thing or if it's a different card, just know that it's two different cards. And each participant in the family is prescribed a tailored food package by a nutritionist, or we also call our nutrition staff competent professional authorities. That's a term from the federal side of our program. So CPA, not a tax accountant, but a competent professional authority. And they do the nutrition assessment and prescribe those food packages. Okay, you can go to the next slide. And then as far as shopping goes, just very quickly, we have over 1,600 stores that accept EWIC or are qualified to accept EWIC benefits. And the EWIC card works just like a debit card. It is attached to that electronic account. So it's not like a gift card or anything. So if the person loses their card or something like that, they can get that replaced and the benefits will still be in their account. But they can use it in the store, just like every other debit card. You can purchase what is needed for that month. And there's also an app. We just actually have a new app. We just are going through a transition right now with our EWIC contractor, and we have an app for folks to use, and it's called EBT Edge. It is the same app as the FNS, the official FNS app as well. So, but they have that available to them to help them with their shopping. And next slide, please. We also provide a shopping guide for folks when they come in for their appointments. And this is a printed guide. It is also in a digital version on our website, but then they also can get a printout from the WIC office to see what their food benefits include. Okay, and next slide. And one of the most important pieces of the WIC program that we provide as a service is breastfeeding promotion and support. This is really important for our families as it is really the best and most nutritious food for our infants on the program. But we provide a lot of information about initiation, duration, and helping moms make informed choices about their infant feeding choices. There's a lot of information that is covered for moms, and the benefits of breastfeeding, ways to make breastfeeding comfortable, how to tell if an infant's getting enough. Those are just a few examples. And we also have, next slide, please. We have lots of information at the program or at the agencies. We have trained staff. We have a breastfeeding friendly environment. We also have a peer counseling program. And we also have lots of breastfeeding supplies that are available for our moms that may need them, things like breast pumps and different things that they may need and may not be able to get if they weren't participating in WIC. Okay, next slide. We also, in addition to the healthy foods and breastfeeding, we provide nutrition education. Again, this is one of the major benefits of the program, and nutritionists will provide participant-centered nutrition counseling, and some agencies may provide group classes. There are also things like mini lessons, and we do have an online nutrition education platform that is available for our participants to complete nutrition education lessons. Participants receive education every 3 months or around 4 times per year. 2 of those times are at appointments within where they may be seeing a person or seeing a nutrition staff for a nutrition assessment or for a mid-year assessment. So the other 2 times are in between those appointments, and depending on the need of the participant, they may or may not be in the office again. They may do something online. They may do something over the phone. It just depends on what they need. But that's really to teach about the relationship of between nutrition, physical activity, and good health, and to help improve eating and physical activity habits for our participants, and to promote the use of the supplemental foods that WIC provides. Nutrition education is always tailored and made appropriate for each individual based on their educational background, their household situation, their language spoken, and then as well as cultural and ethnic preferences. Okay, and then our last pillar, if you can go next slide, the fourth major benefit or pillar of the program is community and healthcare referrals. And these are many of the things we have, many of these programs we have reciprocal relationships with. So we would refer out to for immunizations, for prenatal care, for well child health care, social services, dental care. We try to help coordinate and encourage individuals to seek out those resources that they may need or refer folks as needed. Okay.
Okay.
Yes.
Go ahead. Yep, the last slide.
Next slide.
Go ahead.
Yep, this is just a few last slides here. This is a referral form. If folks need to be referred, or if they want to be refer themselves to the program, they can click on this link that's on our website. And we also have a lot of outreach materials. You can go to the next slide, Francisco. Thank you. We have outreach materials available if folks need them. The next slide, please. And the next slide. And that's, thank you very much. That's all I have. If you need more information about those materials, I can definitely get those to you. Thank you.
Thank you, Sarah, for coming back. And we have a couple of minutes, but we will do our best. Elizabeth, don't kill us, please. And we're almost done with the presentation. And here I'm gonna show the Kayla presentation quickly. You have some slides and a good message to said. Thank you very much. And there you go, Kayla. Go ahead, Kayla.
Okay, good morning, everyone. My name is Kayla Armas, and I am a parent consultant with EDI, the EDI program, NCDHHS. And I am also a mom of a child who was born deaf and received cochlear implants when he was 1 and 2 years old. And now he speaks English and Spanish and is learning sign language. So he's doing very good. Next one, please. What is EDI? EDI is the NC Early Hearing Detection and Intervention Program that belongs to the Division of Child and Family Wellbeing of North Carolina Department of Health and Human Services. This program oversees the newborn hearing screening program and follow-up for infants and young children found to have hearing loss. This program has around 13 parent regional consultants in all over North Carolina that provide help to families and service providers at no cost. And we have a goal. The goal of this program is to reduce or remove potential negative impacts of hearing loss through early detection and intervention program. And we have the 136. That means that all the children needs to have the hearing test for hearing loss. They need to have their hearing test by 1 month of age and have a diagnosis by 3 months of age, and then started their intervention or started receiving resources by 6 months of age. I'm trying to be fast, I'm sorry. Okay, next one. The support that we have for the families, the regional consultants help the families to all these things, but I am here especially to support the Latino families, especially the ones that can't, that they just came from their country, the ones that don't speak English, the ones that are new to this country, the ones that need to understand how the system works. Sometimes I only need to share them my experience, and sometimes I need to help them to understand the type of hearing loss the children have, and help them to understand how important it is to start receiving resources or support as early as they can, because I tell them that my story, that my son, I am blessed to be part of this program, because thanks to their goal, my son was able to receive early intervention and then be successful in life. Next one, please. We also offer consultation, trainings, and education to birthing facilities, medical providers, audiologists, early intervention, and other providers working with infants and children to help meet the EDI goal. And I also help the families to fund the closest audiologists to them, and also to after they go to an appointment, an audiology appointment, I call them to make sure they are fine with what they found out, and they feel like they can continue in that journey. So, and we have this is our information. If you want to know more about the EDI program, there is the website. You can call us, and there's an email, so you can email us. And now I want to talk about these private groups that I started when, because of my experience in this country, and my son that was born deaf, that was something that I wasn't expecting at all. And in that moment, I didn't speak any English. Now I speak a little bit, but in that moment, it was really hard for me to find resources in Spanish. And it was really hard to understand how the system works. And it was really hard to get what my child was needing in that moment. So after when he was 4 years old, I started a support group on Facebook in Spanish for specifically for families that have children with hearing loss. And then when I started working with the EDI program, they support me to open more groups in all North Carolina. So right now we have 4 support groups, and I would love you to share with the people, with your community. And this is a private groups only for families that have children with hearing loss. We don't have any organizations or professionals in this group, because we want them to feel comfortable to talk with other parents and share their experiences. Okay.
Thank you, Kayla, very
Thank you.
much. And Elizabeth, Juvencio, and all partners here, this is part of what the division is doing. You already have our information, but yeah, I believe Juvencio and Elizabeth, we need maybe a day to explain all the resources that we have. But thank you very much. And as you can imagine, we work under the umbrella at the secretary office, and there is 2 colleagues here that you know them already, Jasmine Rico and Carolina. Jasmine, I don't know if you would like to add something regarding the priority of the Division of Child and Family Wellbeing.
Hi, Francisco, and thank you everyone for the presentation today. Let me see. I wasn't ready to present, but the one thing that I can share about the priority of this division, or one of the projects that I have been involved in this division, is the cross-enrollment efforts, which means that we are looking at strategies and pilots, and piloting some efforts to increase enrollment of families in WIC and FNS. We know that a lot of times the eligibility is pretty similar among programs, and if one family is benefiting from one, very likely that they can benefit from the other program. So we will have more information on our findings and results in the spring, I believe, of 2024. So I'll make sure to come back to this group and share more details. But something that Francisco mentioned earlier in the presentation was public charge. And so we know that there's many families in North Carolina that benefit from programs that are eligible for benefits, but they're not tapping into those for various reasons. They might not be aware of the program. They might have been in the program and got out during the last presidential, during the last, during past presidents' that we had that we're instigating a little bit of fear or creating fear among communities with public charge. And so some of the efforts that we are working on is making sure that people know about the programs, that they know how to access them, and that they have the information that they need around public charge. And so for these programs, it would not count as public charge. One of the resources that I have shared with Amex County, one of the summits before, is that fact sheet from the Justice Center, and I will look for it and put the link on the chat if it's helpful. I think we all can help to disseminate that right information with community members. Again, maybe parents are not eligible, but the children are, and we want to make sure that they take full advantage of this benefit. If I may, if I can add one more thing around Medicaid expansion briefly, if that's okay, if we have the time. And I cannot give many details, but I just wanted to say that at the end of last week, the General Assembly passed a final budget that included the final authority to close the coverage gap and implement Medicaid expansion. And Governor Cooper has announced that he will let it become law without his signature. We know that this is a huge step for North Carolina. More than 600,000 people will be benefiting from Medicaid expansion, and we estimate that 50,000 to 60,000 of those who will be benefiting are Latino. And so this is a huge investment that will be coming into our state that will help to keep the doors open of different clinics, facilities, hospitals in rural communities, and will really help for the health of our state. More information is coming today at 1, so I cannot share details, but I encourage you to look at the briefing with the governor and Secretary Kingsley today, and more information will be coming out on a press release, and more details, a little bit more details. Some questions and answers will be shared as well. So I wish this meeting was happening at around like 1:05 so I could share more, but it's a great opportunity to let you know what's happening, and a lot of this work will be taking place over the next few weeks and months, and we hope to continue to count with your support, and we'll definitely be coming back with more details on how you can be part of this implementation effort. And that is all for me. Thank you.
And Jasmine, thank you very much. Just want to remind our partners that here, as you can see on the screen, if you go at the top, you have the languages that you can find, the website that we have. Feel free to share with your families, because we have everything in these languages that are here. And if they click it, they will see information in their language. Thank you very much, Jasmine. Gracias. Thank you so much, Elizabeth Juvencio. And we're done today.
Thank you so much for the great presentation. So we will give it a few minutes if anybody has any questions for our guest speakers that they might have. You can unmute yourselves, or you can use the chat box. There was one from earlier that said, in my county, I find a lot of barriers to WIC providing breastfeeding supplies, work school and requirements. Are you able to speak about this? And that's from Enfield.
Yes, hi there. I did message Anne directly. I gave her specific information for Durham County, but if anybody needs information for a specific county, feel free to reach out to me. We have that information available, and I can put you in touch directly with a WIC director in that agency, wherever you may be. And please let us know if you do hear of any issues. It shouldn't be a barrier or an issue for folks to receive services if they're participating in the WIC program. So it is difficult sometimes, though I know when folks are working and unable to get to a clinic. So, but there's ways that we can help them to make it a little easier. Thank you.
Thank you. Juvencio?
Francisco and Sarah and Kayla, this is a great presentation. My proposal to you guys that you would be interested to have like a series of topics, workshops, English and Spanish that we can leverage to the community. Because I think that the information that you shared with us this morning, it can benefit not just only the community, but also the community partners.
Yeah, I totally agree with that. And actually, we have a couple of folks that they can join us from another sections of the division that they have a really interesting program as well that they can speak. But yeah, definitely let's look for a strategy to do English and Spanish series of the services that the division offers. Thank you for the opportunity.
Are there any other questions for our guest speakers? Okay, if not, if you do have questions and you will want to directly get in contact with
A ver, mira si Héctor intentó.
Sí, Maribel? Oh. I think she accidentally went unmuted. But you can directly contact Francisco, Sarah, and Kayla at their email addresses, and we will be sure to share the information in the newsletter as well. Before we go on to updates, I think Juvencio wanted to share a slide.
I just want to kind of give you an update in terms about what the NC Latino Health Alliance has been doing this year. And also I want to kind of share with you some strategies that we're looking for next year. So community partners, if you're interested to participate, will be wonderful. I know that some of these trip that we took across the state beginning in the beginning of the year, hosting some different community health summits. We did three health summits across the state. We did one in February in Wake County, which we had some great representation from the state and different agencies and our different partners. In August, we had one in Beaufort County. And our last one was in September. It was in Duplin County. And some of you have participated in these spaces. We have collected some great information that we're going to be sharing with you as we put together the report for these health summits. But looking forward for 2024, as we beginning to strategize some ways that we can continue to build a partnership, but also engaging around health equity, is that at the beginning of 2024, we're going to be focused on Eastern North Carolina. And so I'm looking forward to working with you guys and the team here at the NC Latino Health Alliance and to continue to foster these partnerships. Just to kind of give you a little highlights in terms of what we have seen in some of these conversations, it's a huge need for partnership and collaboration with the local health departments and also community-based organizations. There's something that's coming up over and over in some of these settings. So in this work that we're doing in terms about the health equity summits is under the framework of the NC Latino Health Alliance, which is, we started this last year in October. We celebrated 1 year of our NC Latino agenda, which is focused on health, education, public policy, public safety, and economic development. So just want to give you kind of an update on that. And thank you, Maria Elizabeth.
Thank you. We do have a couple minutes left, so we can continue on with updates. For Amexcan, later on this evening, we do have another webinar going on with Rosalie Hernandez. She will be talking about diabetes type 1 and 2 at 6 p.m. It will be in Spanish. If you would like to join that, please join us at 6 p.m. The information will go out again later today. As for October, our next NC Latino Health Alliance meeting will be October 30th at 11. And then also we have 2 weekend events coming up on October 14th. We plan on having a health fair slash tianguis in Wilson at the Casa de Dios. It will be from 11 to 3 p.m. We'll be providing resources and information. So if you would like to come out and join us, it will be October 14th. And then also we are pending at the moment for October 21st for a pink talk. It would be about breast cancer. It will be 11:01. We will share more information on that once we have that as well. Other than that, I'm not sure if anybody else from our staff members would like to share any of their upcoming events, or if I'm missing anything, you are more than willing to go off mute. If not, I will leave it up to our partners. Yasmin, I see you've been.
Yes, quickly. I just wanted to highlight that we have a cafecito, a virtual event tomorrow in Spanish. It will be posted on our Facebook page. We will be highlighting Hispanic Heritage Month and other topics as well. Dr. Viviana from Latin 18 will be the medical provider on the panel, and also Amanda from Sunrise Amanecer. So we just posted the images on the chat, and that information is also on the noticias that Carolina shared on the chat. If you wanna get the public charge information that I mentioned from the Justice Center, it's also on that newsletter. If anyone here does not receive the newsletter and is interested in receiving it, you can subscribe by clicking on the link and scrolling all the way at the bottom. Thank you again.
Thank you, Yasmin. Other than that, I can quickly go down the list of participants to see if you have any updates in fields. Beatriz Alvarado.
Sí, hola, ¿qué tal?
Sí, ¿tiene updates?
No, gracias, todo muy claro. Everything is really good. Good information. Thank you so much.
Gracias. Brenda Robertson.
Yes, I just want to remind everybody, I'm with Legal Aid of North Carolina, and we still have our Affordable Care Act Navigator Project. We are still assisting people with enrollment in the help the marketplace. And we still have the North Carolina Medicaid Ombudsman Project, where we're helping people with issues spotting and giving out information and education regarding their Medicaid plans and assisting them with that. So just want to remind everybody about that. Thank you.
Thank you. Carlotta Dixon.
Hi, this is Carlotta Dixon, Department of Health and Human Services, Division of Social Services.
Hi, yes, do you have any updates or any events that you have coming up?
No, I do not. Thank you.
Thank you. Carolina Perez.
Hi, just the updates that we shared in the chat. I hope some of you all can make it to our cafecito tomorrow evening, and stay tuned. We'll surely have more information to share about the governor's press briefing at 1.
Thank you. Dalia Antunes.
Hi there, good afternoon, everyone. Dalia, I'm a bilingual patient navigator with Duke Cancer Institute's Office of Health Equity. Our main priority is to make sure individuals are connected to a primary care provider, as well as are up to date with their recommended cancer screenings. I do want to make a short plug for an event we have upcoming on October 7th from 8:30 to 2 in Durham. It's called What's Best for Breast. And so it's going to be a morning where the community will have an opportunity to talk and engage with breast experts. I'm about to drop in or drop a flyer for you. Thank you.
Thank you. Danny Moore.
Hi, everyone. Good to be with you today. We are having a transportation statewide convening this Saturday in Raleigh. The reason I'm bringing it up here is that we know transportation for our community members is very connected to social determinants of health. And I will put the flyer link and basic details in the chat. all are welcome, except we are careful not to include law enforcement nor members of the media, so that we can have a community conversation without those folks present. But I'll put it in the chat, and if you'd like to share with others, feel free. Thank you.
Thank you. John Silver now.
Good morning, everybody. Just kind of rejoining this morning. I'm at the Caswell Developmental Center now. I have nothing else to report.
Thank you. And Sharon Munoz. You're on mute, Sharon.
Good morning, everyone. Yeah, Sharon Munoz from Latino 19. And I have big news this week. I'm gonna be releasing everywhere. I'm gonna share with you guys also. Bull City Strong and Latino 19 will start the second Spanish cohort where we're gonna be training community health workers, and it's gonna be on Zoom, and everything is gonna be about health literacy. And we'll be sharing the flyer, the application, and we're gonna be paying the community health workers to come and learn with us. So please be alert on Latin 19 newsletter, on Facebook, on Twitter, and my social media as well, and all the Bull City Strong website, Bull City Strong newsletters, and I'm gonna share with all the other organizations that we are present, because we have only 25 spots for community health workers. You don't need to be a community health worker. As long as you love to share information with the community, that's one of the requisites to be part of. And our dear Francisco Guzman here, Beatriz Meraz, they were already part of the first cohort, and they can testify how wonderful is this program. So we are gonna open and release all the information this week. I cannot say when, but it's gonna be amazing. Again, we have and Maria Luisa Solis, I saw her. Yes, it's gonna be and brand new topics about health literacy. So please help us to disseminate this information, and anybody can take this class. So thank you so much for having me here as Latin 19.
Thank you. If I missed anyone, you are more than free to share updates. The names move around in the participants list. So
Thank you.
Seconds.
Elizabeth, I just would like to mention for the Fayetteville community, we have a listening session, interagency group from the government, different agencies from the government are getting together, and I put the registration link. If you guys know any leaders, any community members for all nationalities, the session will be in English and in Spanish, interpretation in Spanish. And if we identify another language, we will figure out we can do another interpretation service. But yeah, all are welcome. It will be on the 3rd, October the 3rd, Tuesday in Fayetteville, North Carolina. Thank you.
Thank you, Francisco. Anyone have any more updates they would like to share? Okay, if not, thank you so much for joining this morning. I know we went a little bit over time. Thank you again to our guest speakers who took the time out of their day to present today. We will be sharing the recording in the next upcoming newsletter. Also, if you're not a part of the newsletter, I have shared the link in the chat for you to join. Once again, thank you all, and I hope you have a great rest of your Monday.